Morning, everyone. Good morning, everyone, and welcome to the 115th Learn with Lorna. My name is Lorna Steele-McGinn. I'm the Community Engagement Officer with the Highland Archive Service. And as you'll know, if you've been with me for a couple of years now, the Highland Archive Service has 4 archive centres across the Highlands of Scotland. We have the Highland Archive Centre in Inverness, Nucleus, the Nuclear and Caithness Archives in Wick, Skye and Lochailse Archive Centre in Portree, and Lochaber Archive Centre in Fort William. This series, which is designed to bring some of the stories from our amazing collections to you wherever you are in the country or in the world, is brought to you by High Life Highland at no cost to the viewer. High Life Highland is a charity registered in Scotland, and there's no payment or subscription required to take part in this series of talks. But if you're able to donate towards our work, then we're very grateful, and there's a link to be able to do so within the body of text, whether you're watching this live on Facebook or subsequently on YouTube. And a reminder, if you are new to Learn with Lorna, and if you are new, please say hello, because it's always nice to have new people with us. A reminder that all of the episodes can be found back on YouTube and on Facebook, so you can watch all the previous 114 at your leisure. This week we are moving on to a collection that we're really proud to hold at the Highland Archive Centre on behalf of NHS Highland. It's a collection that is regularly used by family historians and local historians, and it's a collection that I use a lot in my role. Now, again, if you're new to Learn with Lorna, my role involves really anything that engages people with the collections that we hold, and they're really diverse. They cover hundreds of years and hundreds and thousands of subjects. And so I go into schools and I go into the prison in Inverness and all sorts of different places to share the stories from our collections. And this is a collection that I use very frequently with schools, with tour groups, and with current staff working in and around healthcare in the Highlands and Islands. This is the Highland Health Board collection. And the Highland Health Board collection is big. It's around 150 linear metres, and it covers several hundred years, from the 1790s through to the 2010s. And it gets added to regularly. It's a collection that is constantly accruing. It is split into sections of information of around about 100 institutions or organisations that are part of NHS Highland. And there are thousands of items in it, and it's Highland wide. So although it's one collection of NHS Highland records, it covers lots of different organisations, and it covers the whole of the Highlands, even though it's held in Inverness at the Highland Archive Centre. One of the first things to say straight away before I go in and say anything at all about the Health Board collection is that we don't provide access to current or very recent medical records. Those are entirely in the control of the NHS. And any historic patient records that we do hold are subject to closure periods. So if you would like to see your current or recent medical records, then the NHS is the route to do that. The patient and staff records that we hold, patient records are closed for 100 years, so we're currently giving access to anything up to 1922, and staff records are closed for 75 years, so we're currently giving access up to 1947. Okay, so what is the NHS Highland collection? Where did it come from? And I thought I would start by reading you the official admin history that we list at the beginning of this collection. It's lovely to see all your comments. Thanks, everyone. And yes, it was lovely to see you at Doors Open Day as well. It was so nice to meet people in person who feel like they know me, but I don't know them. So it was lovely to meet some of you, and I'm seeing your comments coming up there. Okay, so this is the official admin history of this collection. The Highland Health Board NHS Highland Archive includes the records of the present Highland NHS Board, established in 2001, its immediate predecessor, the Highland Health Board, 1974 to 2001, and its predecessor bodies, the Northern Regional Health Board and the respective area hospital boards of management from 1948 to 1974, as well as records of individual hospitals which became part of the NHS in 1948. The collection also includes records of county, borough and parish councils relating to public health, along with related organisations such as nursing associations and colleges. And that kind of very brief paragraph summary gives you an insight into the complex nature of healthcare and the complex history of administering healthcare. There have been so many bodies involved in providing support for those with physical or mental illness over the centuries. So there are independent bodies, private asylums, churches, charities, support groups, committees, organisations, as well as the NHS, which was formed in 1948. Now, I've looked previously in other episodes at churches, at poor relief, things like Dunbar's Hospital, which was built as a charity almshouse in the 1660s, and I covered that in Learn with Lorna 88, which was on the old High Church in Inverness. And so I'm not going to delve into any of those things. I'm just going to focus on the NHS Highland collections and the institutions that became part of the NHS on its formation in 1948. A quick look at some of those 100 plus organisations, the oldest, the biggest, and so on. And I'm going to start by sharing an extract from the absolutely invaluable work of Jim and Steve Leslie. And I've referred to this on several occasions, and if you haven't yet gone out and bought it, please do. This is an incredible body of work about Highland hospitals, split into areas. So there are several volumes of several books that have been written on the different areas across the Highlands and Islands, based on research done in our NHS Highland collections and in other archive material elsewhere. So there's absolutely no point in me reinventing the wheel. Jim and Steve are the people to go to for Highland healthcare history. And so I wanted to start by sharing with you their overview chapter, just to kind of locate us in the story of healthcare in the Highlands. So this is how the Inverness volume opens. We all know where our local hospital is, and most of us will have visited it at some point in our lives. However, the modern hospital has evolved greatly from its relatively simple 19th century form, when for many poor people in overcrowded housing, its main benefit was often to provide space and reasonable diet to allow recovery from illness. Before the 19th century, there is little evidence of any hospital, in the modern sense, within the Highlands. There are references to medieval hospitals, for example in Caithness, but they probably offered hospitality to travellers rather than medical care. The Dominican friars apparently had a 15th century hospital in Inverness and 16th century charters to Inverness from Mary Queen of Scots, 1567, and James VI, 1591. Both mention a hospital, but we have no evidence of its location. In 1589, Inverness Borough paid a lawyer to manage its hospital accounts, and Inverness Kirk Session records mention a hospital in the 1660s, which from other information must have existed in 1641. Dunbar's Hospital in Inverness dates from 1668, but it was intended as an almshouse, as most likely were its predecessors. In Inverness, Cromwell's Fort appears to have contained the Highlands' earliest modern hospital. It had a row of buildings called the Line, with accommodation for sick soldiers and an apothecary shop, a pharmacy. It also had a surgeon, Mr. Miller, and a physician, Dr. Andrew Munro. Balnain House and Dunbar's Hospital were used as short-term military hospitals after the Battle of Culloden in 1746, and there are later 18th century references to a military hospital on Castle Street and a hospital in Academy Street in Inverness, but we have no details of their work. The first voluntary hospital in Scotland was established in Edinburgh in 1729. Inverness opened its Northern Infirmary in 1804, and apart from the cities, it was the third town in Scotland to have its own hospital. In 1847, Nairn followed suit, and apart from wartime hospitals, including Rigmore, all other pre-NHS hospitals were established by 1914. Voluntary hospitals were set up by local organisations, often assisted by a bequest of property, land or capital. They depended on regular subscribers, annual church collections, and most importantly, one-off donations or legacies. Hospitals were not financially viable without this support, and patient fees where charged seldom met the cost of the individual's treatment. This was despite local doctors giving services for free. Outside Inverness, most Highland communities were small, and their resources were insufficient to support a hospital, so that most local hospitals were established that were established were endowed by wealthy individuals. Some of these, such as the Gesto and Skye, existed on their original endowment until they were taken over by the NHS. Voluntary associations and wealthy individuals were not alone in developing hospitals. In 1845, the Poor Law Scotland Act established parochial or parish boards, which replaced the Church of Scotland in administering poor relief and care for the sick poor. Many parishes established poorhouses, and Inverness used Dunbar's Hospital until it built its new poorhouse at Muirfield. The 1929 Local Government Act swept away the poor laws, putting new health authorities, counties and boroughs in charge of the former poorhouses. In the 21st century, we have a single point of access to medical care and integrated health and social welfare services. Therefore, it is hard for us to imagine the administrative fragmentation of the past. Parishes shouldered an increasing range of public health duties, for which in rural areas were woefully too small. And as I say, it's a long extract, but it makes sense for me to share it with you because it gives some idea, as I say, of the range of organisations involved. And I think that final sentence of Jim and Steve's makes complete sense, that it's so hard for us in the UK, and I don't know if there are people watching in other countries, it will be different, of course, but for us in Scotland and the UK, we are so fortunate in walking into a doctor's and having access to so much. And it's quite hard for us to envisage how many organisations and individuals were involved, how reliant it was on church collections or one person giving a donation, and how different your healthcare would be in Skye to in Caithness to in Inverness. Totally different. In addition to that summary, for much of our history, there have also been specific types of hospitals. So things like fever hospitals, TB sanatoria, mental health care hospitals, maternity, military hospitals, and geriatrics. So a very disparate picture. And it really depends, from an archive point of view, who took over what when dictates where the records sit. So for instance, the records of Dunbar's, which started as an almshouse and then became a hospital, those records sit within the old High Kirk, the church records, because they then administered it. So it's quite it's a picture you need to learn to follow the route of where the records might sit. Now, the institution with the oldest records in this collection is the RNI, the Royal Northern Infirmary, which started as the Northern Infirmary in the early 1800s. The records for the RNI start in 1798 because a committee met then to discuss the need for a hospital in Inverness with an overview of medical care. So a body that would have an overview of different types of medical care required. They advertised for subscribers and very quickly they raised pledges of around £2,000, so quite substantial. The first stone for the Royal Northern Infirmary was laid on the 6th of May 1799, and although the hospital was in Inverness, it served communities right across the Highlands and has continued to do so ever since. Now, if you've been following Learn with Lorna for some time, you might recall way back in September 2020, in Learn with Lorna 25, I told the story of Elizabeth McDermott and the Highlands connection to the Caribbean slave economy. And if so, you might remember that I spoke a bit about the Royal Northern Infirmary in that episode. When the idea for a hospital for the northern counties was proposed, the committee looked to those who might support it, who might have money, where was money being made. And in India, in Canada, and in particularly in the East Indies and the West Indies, money was being accumulated by people in the Highlands. And it's very clear in the RNI records, both the minute books and the treasurer's accounts, that there are lists of subscribers and donations given. And it's clear that a substantial amount of money was remitted from overseas, although throughout the hospital's history there was never enough money, and I'm sure that's something that is common still in health services. And it's very clear that some of the money that came to build the RNI came from that slave economy in the Caribbean. And if you're interested in that, please do go back and watch that Learn with Lorna 25. The records of the RNI record the construction costs, They record wills, donations, bequests, fundraisers. And the RNI was opened in May 1804 with a stated capacity. And I am going to use an unpleasant word here. The RNI was opened with a stated capacity of 60 patients and 20 lunatics, just the terminology of the time, as well as some accommodation for staff. Nurses were required to speak English and Gaelic to best serve the Highland population. And many of those who attended the hospital from across the Highlands and Islands in those early years were given rest and wholesome food. And doctors made daily ward rounds, but really it's a large amount to do with rest and diet and health, kind of holistic healthcare. And over the next decades and centuries, the RNI was expanded and redeveloped and repurposed as medical knowledge and the healthcare landscape of the Highlands changed. The role that the RNI played changed. The RNI collection is extensive. As well as the minutes and the financial records that I mentioned, there are also record books of House Committee, which record the attendance of the visiting doctor, matron and resident surgeon and the managers. There are details of patient statistics, consumption of wine, spirits and port by the patients, and other remarks about patients in the hospital. There are also historic patient registers in this collection. So for instance, there's an 1814 to 1817 register, which lists the outpatients applying for advice and medicine. And also there are staffing records such as nursing registers. Annual reports are one of those things across all collections that sound really dull, but give a huge amount of information into whether it's a school, a hospital, an organisation. And the annual reports for the RNI give a large amount of information. So for instance, the 1914 annual report records all the subscriptions and donations received and who they were from, patient statistics, details about the wards, the office bearers, the finances, the staff, and also the fact that patient numbers. So it records the fact that 519 inpatients were treated and 291 outpatients in 1914. Now, I mentioned that it also refers to the staff, and this is an extract from that 1914 annual report about the RNI. Dr. Elder resigned his appointment as house surgeon on the 9th of September last, and the directors appointed Dr. C.P.M. Juber to take up his place. The directors are finding it increasingly difficult to fill appointments when vacancies occurs, and this difficulty has been greatly enhanced since the outbreak of the war. So much so that the directors have been obliged, temporarily at least, to considerably increase the remuneration for the house surgeon. Dr. Juber would not engage for a longer period than 6 months, but when that period expired, he continued to act for another month. On his leaving, the directors, failing to secure a permanent successor, were obliged to arrange for a locum tenens to do the work until the permanent house surgeon could be secured. Since the war broke out, the following members of the staff have been called up for military duty. Of the consulting members, Dr. J. Munro Moyer. Of the acting members, Dr. J. W. Mackenzie and Dr. Duncan McFadden Jr. And of the assistant members, Dr. Mitchell and Dr. A. Fraser Lee. Of the nursing staff, the matron of the convalescent home and one sister have been called up for duty with the Territorial Forces Nursing Service, and 2 sisters and 1 nurse have also gone. So, using something like an annual report gives an insight into the impact of the conflict on the hospital, but also it gives us lists of members of staff who have had to go off and serve. The 1914 annual report also gives a record of the provisions that had been made in the hospital on the outbreak of war in case the hospital was required. And this is that section. Treatment of sailors and soldiers in the hospital. At the outbreak of the war, the naval medical officer in charge of the district applied to the directors to see if they would open the wards of the infirmary and, if necessary, erect marquees in the ground for the treatment of wounded sailors in connection with the naval base at Cromarty, as it was at that time thought that immediately on the outbreak of hostilities there would be naval battles in the North Sea, which might result in a great number of wounded sailors requiring to be treated. The directors accordingly arranged with the staff surgeon in charge for fitting up a number of beds and providing all the additional equipment required for them on the footing of the Admiralty paying the whole extra expense of this equipment. The arrangement thus made provided for over 100 beds, but eventually the naval medical authorities intimated that they would be content if 100 beds were reserved for naval cases. Subsequently, the military medical authorities made an application for provision of beds for wounded soldiers, in consequence of which the Admiralty restricted the number of beds to be reserved for them to 50. After various negotiations, however, with the military and the naval authorities, the directors arranged that the number of beds to be provided for naval cases shall be 50, and for military cases from Cromarty defences, 25. But the provision of these beds does not in any way encroach upon the accommodation for ordinary patients. And yes, Jenny, you're absolutely correct. Constant shaping of the two world wars on every aspect of life. We are constantly coming across that in all of our records. And just the fact that the naval base being nearby meant that this provision needed to be made in Inverness. But of course, there were also specific military hospitals set up right across the Highlands and Islands. In addition, there are papers related to the lighter side of working in a large organisation and a large team. So, for instance, the RNI records include records of the creation of the RNI Staff Club and the Inverness Health Services Club, and a large number of photographs of wards and staff, and a visitors book which records people coming to the RNI for training from Sierra Leone, from India, South Africa, America, Australia, and right across the UK. The RNI became part of the NHS on its formation in 1948, and it is still in operation today, in part on its original site, offering community hospital services, so things like intermediary beds for those waiting to go into hospital or recovering coming out of hospital. That is a whistle-stop tour through one part of this NHS collection, which covers hundreds of years and hundreds of documents and tens of thousands of patients. And that's one of the oldest and largest collections within the NHS records. Another of the largest is HHV3, the asylum, but I've spoken about that on several occasions previously, so I'm not going to go into that today. But not all of the 100 or so collections that form the NHS Highland records are of the size of the RNI or the Inverness District Asylum. So, for instance, the Donaldson Memorial Nurses Home in Wick, we only have one item for that, a visitor's book from 1906 to 1914. For the Inverness District Queen's Nursing Association, we have one minute book from 1940 to 1951. For the Glencoe Hospital, we have one photograph dated 1990. So you can see that, as with all archive collections, coverage depends A, on what's survived, and B, whether what has survived has come to us. So it depends on where it's been kept, who's been responsible for it, whether anyone saw the value in preserving it, whether anyone saw the value but wanted to keep it for themselves or keep it for a community archive. So all of these things have to be taken into consideration when you look at a surviving collection that we hold. There are two particularly key dates in the story of healthcare in the Highlands and Islands, 1912 and 1948. 1912 because it was the date of publication of the Dewar Report, and I have referred to this previously way back in Learn with Lorna 7, and I will do a full session on it in the future because it is so fascinating. It's such a key point in the story of healthcare in the Highlands and Islands, in Scotland and in the UK. But I'll do a summary of it here. The Dewar Committee, which was named after its chair, Sir John Dewar MP, was set up to look into medical service provision in the Highlands and Islands after it was realised that the 1911 National Insurance Act, which was designed to provide health insurance for industrial workers, didn't cover crofters and didn't cover a vast swathe of people across the Highlands and Islands. So although the National Insurance Act was huge and it gave medical insurance to a lot of people, it didn't cover a lot of people in the Highlands and Islands. And so the Dewar Committee was set up to examine the state of healthcare and healthcare provision in the Highlands and Islands. And the committee travelled around the Highlands and Islands, gathering evidence, recording testimonies, and asking questions to people about their experiences of healthcare provision. And the evidence amounted to some 23,558 paragraphs of evidence. Their research revealed a shocking picture of health inequality. Poverty, hunger, and insanitary conditions were very common in the Highlands and Islands, and they were taking a severe toll, particularly on the very young, the very old, and nursing mothers. As doctors needed to be paid, many of the illnesses went untreated because people couldn't afford to pay for the doctor to come, and a high percentage of deaths were going uncertified. There was poor relief available, but the stigma that was associated with claiming poor relief was such that it was an absolute last resort and many people wouldn't turn to it. And this, I think, is one of the most powerful sentences that I have ever come across in my job. It is extraordinary. The Dewar report, when they wrote up their summary of what the state of healthcare provision was in the Highlands and Islands, they concluded that healthcare is a basic human right, regardless of income, class, or geography. And I think that is an extraordinary statement, and something that has formed a huge amount of life in this country. So yes, the Dewar report concluded that healthcare is a basic human right, regardless of income, class, or geography. And it made a series of clear-cut and specific recommendations to improve the situation, including set charges regardless of the distance that the doctor had to travel, a requirement for doctors to have a basic salary and a house. And the report was so shocking in the evidence that it included that it was very quickly approved, and that led to the formation of the Highlands and Islands Medical Service. Now, we hold copies of the evidence within our County Council records, and also a copy of that final Dewar report and a photograph of the committee within this NHS Highland Health Board collection. The Highlands and Islands Medical Service was revolutionary. It was the first state-provided health service in the world, and it transformed healthcare provision for over about 300,000 people across half of Scotland's landmass. It's considered to be the precursor for the next major date, 1948, which saw the formation of the National Health Service, the UK's state-provided healthcare system, which is close to the hearts of many, many people in the UK. And if you're watching from out with the UK, I am quite sure someone will tell you how much we value our NHS. In June 1933, a committee was appointed to review and make recommendations on the existing healthcare in Scotland. This time the chair was Edward Cathcart, and again this report was revolutionary in its conclusions and recommendations, which focused on the need to make good health the norm through health education and other means. So rather than just reactionary and treating health problems, the aim was for a preventative system that would make good health just the standard, the normal situation. In his report, Cathcart praised the Highlands and Islands Medical Service that had started 15, 20 years earlier. And we hold a copy of the Cathcart report in our collection as well, because by this time, thanks to the Dewar Commission, the Highlands and Islands had better healthcare than anywhere else. Having gone from the situation of being the sick man in the country, because of the Highlands and Islands Medical Service, healthcare in the Highlands and Islands was then at a better level than elsewhere. And so when Cathcart was writing his report into transforming the health services, he looked to the Highlands and Islands Medical Service. And the Cathcart report was part of a growing call to transform healthcare across the UK. And in 1942, the Beveridge report was published, because the government was looking ahead. They're in the middle of the Second World War, and they're looking ahead to what the future is going to be for the country after the war. And the Beveridge report was written by Sir William Beveridge, and it was again a passionate call for change. And again, unusually, it was a bestseller. Really interesting that all three of these reports, the Dewar, the Cathcart, and the Beveridge, were all really well received and bought and shared and distributed. And we hold papers relating to the Beveridge Report in our collection as well. And we also hold a copy of the 1944 Ministry of Health for Scotland booklet, which is entitled A National Health Service, the White Paper Proposals in Brief. And this marks the moment that all of those health schemes and all of those reports and committees came to a head. Under a Labour government led by Clement Attlee as the Prime Minister and Aneurin Bevan as the Health Secretary, Nye Bevan, who had seen medical aid societies, what the difference that medical aid societies could make in his home country of Wales. All of this came together to form what would become the NHS, the National Health Service. Now, the NHS in Scotland was eased in due to the work that had already been undertaken by the Dewar Report, the Highlands and Islands Medical Service, and the Cathcart Report. That kind of groundwork had already been laid, and so for Scotland, the start of the NHS was really quite smooth. Now, when the NHS came into being, many, but not all, of those disparate hospitals, bodies, and providers that I mentioned at the beginning came under one umbrella. Not all of them, but a large number of them. Very much like when the Education Act came in and took over all the varied and disparate schools that were operating. And so because of that, within this collection, the NHS Highland Health Board collection, we have numerous records which post-date that key turning point of 1948. So for instance, we have minutes of boards of management, such as the Skye Hospital's boards of management, property records. So we have the plans of the Ross Memorial Hospital or the Caithness Central Hospital, Department of Health circulars that were circulated post-48 to all the organisations, papers relating to nursing schools, publications, photographs, handbooks, and manuals. So a huge amount of material from post-48 as well as pre-48. That, I'm very aware, has been a very quick look through a huge subject and a huge collection. And as I say, something that is so close to the hearts of many of us across the UK. If you're interested in knowing more about this collection, please do contact us, or please come in to Inverness, to the Highland Archive Centre, and have a look. All of the records, although they talk about the Highlands in general, all of them are held at the Highland Archive Service Centre in Inverness as one collection. So please do contact us if you want to find out more about that, or drop back into the other episodes of Learn with Lorna that I've mentioned through the course of this, where I've touched on different aspects of this. I can't believe I've done a rundown of Highland healthcare, and I'm finishing just about on time. Thank you for joining me for this summary of a huge collection. I hope you can join me next week. Next week I will be looking at Boys Brigade, Girls Brigade, Guides, Scouts, the uniformed organisations. So I hope you can join me for that. I will be in Lochaber tomorrow, so if anyone is taking part in our LGBTQ session in Lochaber, I will be there tomorrow. And if not, if you're in Wick, I'll maybe see you in a couple of weeks at Doors Open Day in Nucleus. But in the meantime, thank you so much for joining me. I look forward to speaking to you again next week. And a reminder that this series is brought to you by High Life Highland at no cost to the viewer. High Life Highland is a charity registered in Scotland, and there's no payment or subscription required to take part in this series of talks. But if you're able to donate towards our work and enable us to carry on sharing our collections, then we'd be very grateful for that. And as I've said previously, please do have a look back over YouTube at all our previous Learn with Lorna episodes, and hopefully I'll catch up with some of you soon. Thank you.